and welcome to my podcast where we're going to be bringing you more insight into the asylum system here in the UK. Today, I am joined by a young lady. Her name is Sam. She's a friend. She's also in the asylum system like me, and she's worked alongside other organizations as a volunteer with the purpose of helping fellow asylum seekers integrate in the UK system. Sam, hello and welcome to my podcast.
Hi, Kathy, and hi, everyone. My name is Sam. I'm an asylum seeker, and I'm passionate about volunteering and empowering asylum seekers and refugees. I'm excited to be here, and thank you for having me, Kathy.
Oh, it's always good to hear your voice, always so bubbly. What are you doing in lockdown? You must be enjoying it.
I've been doing a lot of painting and arts and crafts and DIYs. I'm just trying to keep sane, Kathy. How are you surviving?
I'm well, to be honest. It's been quite an interesting week. My two kids, they just had their birthdays, and so it has been very demanding, to say the least. Very demanding. So yeah, that's it. But yeah, it's good. It's good. I'm not complaining much.
Yeah, I'm glad you're okay, and wish your kids a happy belated birthday for me.
Oh, thank you so much. Now, Sam, we're going to get straight into business. The aim of this podcast is to pretty much look into the impact of the asylum support generally and in the COVID-19 context. To help a person who's hearing this for the first time, asylum support, how does it look like? Can you briefly explain it, please?
I definitely agree, Kathy. I think a lot of people aren't aware that asylum seekers are not entitled to mainstream benefits such as universal credit, or we are not allowed to work, and we are forced to live on this asylum support. Asylum support is support provided to asylum seekers, and it's a financial support of £37.75, so just over £5 a day, and accommodation.
Right. Now, this accommodation, when you say accommodation, what does it include? Does it include Wi-Fi, tele? How does it look like?
We are provided with accommodation, Kathy, but it's not a home. It's a temporary accommodation. Strangers come and go. We don't have Wi-Fi in the house, and we do not have a TV because we can't afford £157 on a TV license. When I first moved into my accommodation, Kathy, there was no shower head, no Hoover, or even a mop or bucket. I had to buy or get support from charities to get these items. The accommodation is not suitable, and as we speak, I have a leak in my bedroom ceiling. We don't have that extra money to make our accommodation a home or to make it a nice environment to live in.
Now, this £5 does not include travel, obviously. Neither does it include communication expenses. Now, how can one possibly manage with £5 in their pocket?
£5 is not sufficient to live on, Kathy. On this support, we are forced to live in poverty. It has had a massive impact on our mental and physical health, and it hinders integration. We are forced to choose daily between food, clothing, travel, and even having a social life. And just to paint that picture, Kathy, I'm a volunteer, and I volunteer 5 days a week. That's £4 a day to get the bus, £20 a week on travel. I'm left with £17 to buy food and other basic needs. Even if you were to go to Poundland or Pound World, as a woman, I need toiletries from shampoo, sanitary towels, face cream, hair products, and I haven't even covered my clothing. To buy the cheapest coat in Primark is £15.
That's very sad. That's very sad, and that's the reality anyway. Typically, asylum seekers cannot afford the TV licenses, like you're saying, and a life of an average person. Now, how does that impact our mental health? Because that's the topic, especially now. We had one asylum seeker who just passed on, sadly, and it's also due to the circumstances of the asylum support and the living conditions that most asylum seekers are suffering here in the UK.
Yeah, it has had a massive impact on asylum seekers' mental health. My colleagues go out for drinks at the end of the week. My friends go out for a coffee or a meal. But as an asylum seeker, you can't afford to buy a drink or go out for a meal or go to the cinema. And because of this, we're unable to integrate into society. It lowers your confidence. It doesn't do anything for your self-esteem. And reflecting on my own personal experience, Kathy, I've felt depressed at times, not being able to socialize with my friends. And the Mental Health Foundation did a research, And they say 61% of asylum seekers experience poor mental health, not just because of past trauma that we experienced, separation from families, difficulties with the asylum process, but also poor housing.
That's really sad. And now we are in the COVID-19 context, and things have really changed. And the asylum support that is crippled already is being exposed now in the asylum in the COVID-19 context. What would you say about the impact of the asylum support on the asylum seekers in the COVID-19?
12 years ago, asylum support was £42. Prices have gone up since then. Food, clothing, travel, it's really expensive. And over the years, since 2000, mainstream benefits such as universal credit has increased from £53 to £74. But asylum support remains at £37. And as you said, Kathy, universal credit has been increased to support people through this hardship, to allow people to have a safety net. And now more than ever, we need that additional support, Kathy. And there is evidence that we are struggling. The price of food has gone up. In my local shop, I used to get 3 plantains, the African bananas for £1.
Oh, yes, the African bananas, they're my favorite, actually. And yes, they have gone up. I mean, amongst many other things, they too have gone up. We used to get them for 3 for £1. Now they are 2 for £1. Yeah, I agree.
69 pence each. That's one less meal. 500 grams of chicken is £6 now. My housemate told me today I can't afford to buy spinach because it's £1. She used to buy a bag of spinach for 30 pence.
Mm-hmm.
My housemate, who is classed as vulnerable, it has been extremely hard for her, to cope during this crisis. She has mobility issues, so she can't walk too far and depends on doing her shopping locally. Our Aspen cards that they issue, our payments, we cannot be used online.
Your friend, the one you're referring to, does she have Wi-Fi? Does she have tele? Is her accommodation just like yours as well, with all the mobility issues that she has?
Kathy, she doesn't have Wi-Fi in the house. She has no television. She has no laptop. She can't afford to buy credit or data to call her loved ones. And, we cannot self-isolate like a normal household because we have nothing to keep us entertained. Some of us are used to going to libraries to get access to a computer and to our friends' houses to watch a film, or charities to get that additional support. I know my housemate used to go to a local women's group run by a charity, and they would provide her with food, clothing, and she'd go to classes and activities. And now that now that we're in lockdown, we cannot access the support charities provide. And it's extremely hard for us, and our mental health is declining. And I think this is very alarming.
It is alarming indeed. And, just not having tele at your home, not having internet, it's very difficult because now most of our lives, they are spent indoors. You are in the house almost all the time. And then you don't have that. And some of us have children. And when they don't have tele, when they don't have that, it makes it even more difficult now that they're doing most of their schoolwork at home. And it's just baffling how we expected to live like the rest of the world in a time as this.
Yeah, it's really sad, Kathy. I know. And I was reading a story in The Guardian of how our fellow asylum seekers are being made to share beds with strangers,
Mm-hmm.
forced to share a room with 4 people at a time of an outbreak of a virus. It's really shocking and heartbreaking, Kathy.
It is. And it's an economic crisis, like we said earlier on. And you mentioned that the universal credit have been increased due to that reason, and others as well. We don't know why we cannot be justified as worthy being who are being equally affected. Like you go in a shop, there are no shelves for asylum seekers where you're going to get special prizes just for you. So,
Yeah.
and then you have the Home Secretary at the other hand saying, you know what, there's not enough evidence, or there's no evidence at all to support the claims that asylum seekers are being affected uniquely.
The Home Secretary, she says she's committed in providing the right kind of support for asylum seekers. I'd like to see her budget on £5 a day and self-isolate with no Wi-Fi or cramped up in a shared room. How is £5 a day justified as sufficient at a time of crisis? Why have we been excluded when we are facing an even bigger hardship?
Exactly, exactly. And the reason why we are also making this podcast is because they want evidence. We don't know how to give them that evidence. And we are hoping that probably they will listen to this and hear it from the horse's mouth. This is what we're going through. And we are representing all the other asylum seekers. And we are underrepresenting them because there are many cases out there of the struggles that we are facing, the hardships that are even being more heightened now in the pandemic. So it's just crazy. It's a crazy world. It's crazy out there. And let's hope that it will bring about the desired results, Sam.
I hope so too. I hope so. And I hope the Home Secretary listens to our podcast, listens to your podcast.
Oh, that's great. And any last words from you before you go, Sam?
Kathy, just if I didn't receive the informal support that I get from charities, I'd really struggle to survive on £37 a week. And sadly, this has been left to charities to provide that additional support for asylum seekers. But I'm a huge believer of remaining positive, Kathy. So just to end with a quote, if we believe that tomorrow will be better, we can bear a hardship today. I think as asylum seekers, we bear our hardships every day, especially at this time. But we should always believe and hope that tomorrow will be better.
Oh, thank you so much, Sam. Thank you so much. That's very encouraging.
Thank you. Thank you for having me, Kathy.
Oh, you're welcome. It's my pleasure. Now we're going on into the next second segment of our recording. And I'm so pleased that I'm also joined by Mariam. She is the head of the campaign team from Refugee Action. And she evidently loves her work and she's very passionate about campaigning on issues to do with the asylum seekers. And I'm very happy that she is here to give us more light on the asylum system. I'm so pleased to have you, Mariam. Thank you for coming.
Oh, hi. No, it's really great to be here. Thanks so much for having me.
Now, we're talking about asylum seekers, and you're so passionate about us. And so that's why we've invited you. And I've just been talking to Sam, and we do find it baffling that the Home Secretary finds no evidence to support the struggles of asylum seekers in relations to asylum support, when there are many organizations like your Refugee Action and many others, as well as media sources even, that continuously highlights and campaign on those issues. Does it surprise you at all that the Home Secretary is blind to our struggles?
It really does. As you say, organisations, not just during the COVID-19 crisis, but for years have been saying that the £5.39 a day is just not enough. But since the crisis began, we've been working with loads of other organisations and experts by experience across the country to do so much to raise this with the Home Secretary. We've been speaking to Home Office officials directly. We've been writing to the Home Secretary. We've been supporting petitions to the Home Secretary. We've been getting people to email their MPs to get in touch with the Home Office, and we've been involved in getting this out to the media. So it is baffling, to say the least, that this wouldn't be something that the Home Secretary and at least her team would be aware of.
Yeah, you've just made it more clear that there is so much evidence out there. And talking about evidence, the government has once again highlighted the overcrowding issues in government accommodation provided for asylum seekers. The shared rooms and even shared beds, as we've seen in other cases, has constantly undermined the social distancing aspect. Any hopes that the government will look into this urgently?
Yeah, I mean, the stories that we're hearing are completely scandalous. And I think similar to asylum support rates, for years we know there have been huge problems in asylum accommodation. So this isn't new. But the coronavirus crisis is very much shining a spotlight on how people are being forced to live in a way that is completely undignified, but also in this crisis, it means that they are finding it very, very difficult to isolate themselves and to socially distance. And like you say, people being forced to share bedrooms with people who are not part of their family, with strangers, people to possibly even share beds. It's unthinkable when you look at all the other government advice about staying 2 meters away from anyone apart from those in your very close household. In terms of what the Home Office is doing, we are talking to them on a very regular basis about this. Some advice, some changes have been made. There has been bad communication, miscommunication at different parts of the country. Different providers are doing different things, but very slowly it seems as though some things are getting better in different parts of the country. But I'm unfortunately, I'm not in a position right now to say that every person seeking asylum right now is able to socially distance and to self-isolate. That is palpably not the case right now. So yes, some action has been taken, but much more needs to be taken urgently.
Oh, that gives some kind of hope, and we are grateful for that. Now, the perspective of Home Office on Asylum Support, I do not know what criteria they use to justify £37 per week. And most asylum seekers and many people who work with asylum seekers, they are really concerned. And we want to know, what criteria do they use to justify the 37.75 a week?
It's a really, really good question. And do you know what? The simple answer is that it's not justifiable, actually. And that's what we've been saying for years. A bit of history, if you'll forgive me, behind this, to just kind of explain why people are in this situation. So for years, people seeking asylum were given 70% of mainstream benefits. And that 70% was because it was an acknowledgement that they didn't have to pay for their utilities in certain parts of their accommodation was provided. So that's what was happening for years and years. And then in 2008, that link with benefits was broken. And the reason for that, well, there are several reasons. One of them was the argument that people were not having to wait for very long for their asylum claim to be decided, which, as we know, is very much not the case anymore. Anyway, so that's why over the years the amount has decreased and decreased, because it hasn't been tied formally to 70% of mainstream benefits. So in terms of how they justify, because before it was simple, it would just be 70% of mainstream benefits, simple. Now, every year, every other year, the Home Office spends up to 6 months going through a particular methodology, which comes up with the, at the moment, £37.75 per week. And they look at kind of two key things. They look at the Office for National Statistics average household spend, and they look at what the 10% of the lowest income households is spending on their average things like toiletries, clothing, etc. But then they also they undertake what's called a mystery shopper exercise. So they get the Home Office officials to look across kind of online deals, bulk deals in supermarkets. What's the cheapest you could get something in a particular store? And that's what they say a particular item, like a bar of soap, should cost. So essentially it's a way of driving down how much they think people can live on. But the reality is that methodology is completely unfeasible. It's not justifiable, because firstly, people arrive often unable to speak the language, or that they're new to this country. They're not in a position to navigate a society whereby they're not going to be able to shop around for the best deals. They might not be in the centre of cities, so it's harder for them to go to the particular store that has the cheapest bar of soap or whatever it might be, or shoes or whatever. People arrive at different points in the year. So if they arrive from a hot country, for example, and don't have a winter coat and winter clothes, how are they going to get what they need on just £37.75 per week? And crucially, that initial justification that people didn't have to wait too long to get their claim, we know that's not the case. Many people are waiting months and months, if not years, for their asylum case to be decided, and they're living on £5.39 a day during that time. That's completely unjustifiable.
Mariam, I do understand that as head of the campaigns team, that some of the arguments that you present to the Home Office in regards to asylum support, like it's not feasible anymore, we have to wait longer. Are they responding to those arguments, to those campaigns? Is there anything positive that we can look forward to?
Yes, that's the key question. So our Refugee Action, we've worked for years. We've actually taken the government to court on this issue. We did that in 2014. But over the last few years, we've had very little success. In particular, a great organisation called Asylum Matters did some work a couple of years ago, and they were able to convince the Home Office to increase asylum support by 80 pence, which, of course, that's a tiny amount, but at least it was something. But in the coronavirus crisis, we thought, and we still do think, this is an opportunity. An opportunity is too big a word. It's essential that people seeking asylum are given more money, because it's clear more than ever before that £5.39 is not enough to live normally, let alone during a pandemic. So what's the Home Office doing? It's been 2 months since lockdown, so they are not tackling this with the urgency that's required. They need to make a call on this as soon as it became clear that we were living through this huge pandemic and a health emergency, but they haven't. So already they haven't acted urgently enough. However, through our conversations with the Home Office, we know they are looking at this. We know they have sped up their process of reviewing asylum support rates that they were due to do this year. So we are waiting for an announcement from the government any day now, and we expect that there will be some increase. We can't guarantee that, but I would be shocked if there wasn't some increase. The question is how much, and we are doing all we can to make sure that it is not 80 pence, but that it is actually proportionate to what those are mainstream benefits have got. They've got, rightly so, a £20 uplift per week. We have been calling for the same, but we have to wait and see. We're going to do all we can to try and get the best that we possibly can, because we have to.
Wow, that's very helpful, Mariam, and we really do appreciate the work that you are doing as Refugee Action and all the other organizations really that are supporting us. But we feel incapacitated as to what we can also do in terms of trying to get our voices heard or try to amplify the voices. For instance, the Home Secretary asked for evidence, and we are the ones who are at the mercy of the Home Office. We are the ones who are being hit hard by what's going on. We don't know what we're supposed to do. We do not know how we're supposed to react. We do not know if they need more evidence. How are we supposed to be giving them that evidence? What advice can you give the asylum seekers who are listening to this podcast?
Yes. First of all, what you're doing today is really important. Raising awareness about the issue is so key, and there are lots of people, MPs for example, that we're talking to who just weren't aware of how little people seeking asylum have been living on. Even though we've been saying this for years, now it has been a good opportunity to engage people who haven't really ever put much thought to this before. So the more that people can share their story, whether through things like podcasts, on social media, writing blogs, things like that, that is important. We've worked with experts by experience already to kind of share their story in the media. We need to keep doing that. So if people have particular stories to share, in particular, we're interested to hear from people who are finding it now, who can explain how, because of the coronavirus crisis, they are no longer able to buy what they used to be able to buy. So that might be because food banks are closed, charities they relied on no longer able to support them, because we know lots of people seeking asylum have to rely on charities to help top up what is such a tiny budget each week. So if people have a story to share about how this is impacting their ability to survive, if they're hungry, if they feel they're unable buy the soap and the disinfectant they need to stay safe. We want to hear that, and we can work with them to try and get their story into the media. It's not easy, but it's something we can do. We want to work with people to do that. People can write to their MP and outline what's happening to them, and ask their MP to write to the Immigration Minister, to write to the Home Secretary. They could get in touch with their local paper, write a letter to the editor of their local paper to explain what's going on and how they think action needs to be taken. And I think also, coming back to evidence, evidence is so important. And if there are things that experts by experience groups can do to really show how partly the coronavirus crisis is affecting their ability to budget to buy the things they need, but also how £5.39 a day is not enough, because particularly now people are in a situation where they can't access necessarily the food banks that they're used to, for example, or charity shops. It's an opportunity to really show, well, actually on £5.39 a day, if that's all I have no other support networks, this is what I can afford. This is what I can afford to spend to buy and no more. So some kind of evidence gathering. It might be doing surveys. It might be keeping a diary of a budget diary of what people have been able to spend each week, what they're getting. That is evidence that could be useful, not just now, but in the longer term, as we try and make the argument that even post the coronavirus crisis, we need to relink asylum support to mainstream benefits, so that people seeking asylum are never in a situation again when they are on 40% of what those on universal credit currently have. People on universal credit have £90.35 per week. That is 60% more than those seeking asylum on £37.75 a week, and that's unacceptable.
Thank you so much, Mariam, for that. It was so insightful. And what I did find very intriguing was making budget diaries as part of our evidence. I think that's so crucial, and that's something that we all can do. And hopefully, with all the other advices that you've given us, we'll be able to tackle more and bring the evidence that is needed. I'm very grateful, and we all are. Thank you so much, Mariam.
No, it's great. It's great to be on this, and thank you for all the work that you're doing.
All right. Thank you. That was Mariam from Refugee Action. She's the head of the campaigns team. And hopefully we'll be having her again as we do more updates in the next podcast on the asylum support. My name is Kathleen. Thank you so much for joining me once again. It's a goodbye.